Oh, hey, good day, everybody. Today is Thursday, February the 4th, 2021. I wanted to make this video about on the subject of healing and pain and healing. And this is kind of a epiphany I had at some point in time. And I don't know why my skin looks so white in this camera. I don't think I look this white in real life. Anyway, whatever. This epiphany that I had when I've had some health issues in my life, including dental issues. Like I always tell people, I'm missing 4 teeth. They're all in the back. You can't tell. I frequently am complimented on my teeth. Well, frequently might be a bit of a stretch, but from time to time, I'm complimented on my teeth, what good condition they're in. So it's not like I have bad teeth per se, but for my entire life, I've had cavities from the age of a child all the way up through my adulthood. I always had cavities, like always. So, and I'm going to put this down so it's not so jittery. And I'm also going to change the orientation. Okay, so how's that? It's a little better, right? All right, so so I want to talk about this healing and pain and healing. And it's an epiphany I had when I was learning to deal with my own teeth. I haven't been to the dentist in 20 years. I don't go to the dentist. I will only go to the dentist in the case of an emergency. I may go to the dentist to get these 4 teeth replaced. I have a half tooth here, a completely gone tooth here, completely gone. And I have another tooth over here that was falling apart in the middle, so only the sides were left, and they were sharp points sticking down. And a dentist did an exceptional job filling in the middle with some white ceramic stuff. And he said, this. Don't use this as a permanent solution. This should only last a couple of years. That was like 20 years ago, so it's a long time ago. So 15 years, I can't remember. I'm terrible with time, but something like that, 15 or 20 years. So and it's amazing. So obviously, if I'm going to do something like that, I don't have a home remedy for that, right? I mean, now if you do have a root, reportedly, if you have a root and it's not rotted out and all that kind of stuff, if you have a living root, then the tooth, you can regrow the tooth. I have had no success with that. I've had no experience with that. I can't speak to that. I mean, unless it's happened and I didn't know it with respect to cavities. For example, if you have a cavity, the tooth can heal itself if you give it the opportunity to do so, which is another. How you give a tooth an opportunity to regrow is another thing. But maybe I'll get into it here in a minute. But anyway, the point is that when I first started messing around with my teeth, I was having all these problems, and I just at some point in time I got sick and tired of having tooth problems and going to the dentist and getting them fixed, because I hate going to the dentist just like everybody else, just like everyone does, I think. And so I remembered that what my grandma used to say about hydrogen peroxide. She said she used to brush her teeth with hydrogen peroxide once a week, and every time she went to the dentist, they were always amazed that she had no plaque. So now, my grandma, this is my mother's mother, she was widely regarded as being crazy, and not literally, but yeah, she was actually in a mental hospital, but that was for depression. It wasn't for like schizophrenia or anything like that. It was for depression. But I mean, she had some mental issues in her life, right? So as a child, I didn't really know how to put those comments about her mental health into context. To me, it just came across to mean that anything she says I should dismiss, basically. I mean, that's kind of harsh. But when you hear people talking bad about other people and you don't have the intellectual capability to put things in context and add perspective and balance to things, that's what you do, right? I mean, that's one of the things you do. It's probably one of the most common things you do. You just say, oh, okay, well, I don't need to listen to that person ever about anything, and that's kind of the way I was. So, but when I got older, I remember this. I said, well, I'll give it a shot. So I did the hydrogen peroxide, and it was very painful. It chews up your gums, and like your gums peel, and it hurts. Your teeth hurt. It's very painful. But I did it once a week or so, for a little while, and then I went to the dentist, and sure enough, I had no plaque. I couldn't believe it, because that's my least favorite part of going to the dentist, when the ladies with a little torture tool, it's like like a sideways C-shaped metal tool with a sharp point, and they just scrape. Oh, and then they jab your gums with it. Oh man, that's horrible, right? So she's like, click, 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 click. She just clicked. She just like tapped my teeth. And she's like, you don't have any plaque. And she was shocked. And I was like, yeah, well, I did what my grandma told me to do. When I stopped, having that childlike perspective about people, just listening to what people say and using that as a blank summary judgment on the person that they're talking about, as opposed to giving the person that they're talking about a chance to speak for themselves and to represent themselves and to say, well, yes, I do have the problem they're talking about, but I have these qualities over here. So, and everybody has issues and qualities. So, a child doesn't have the capability to think like that unless they're taught to think like that. I wasn't taught to think like that. So once I stopped doing that, once I stopped thinking like a child with respect to my grandma, then I did this and it worked exactly like she said it worked, right? So I said, well, I guess I'll just continue doing this because this is actually pretty cool. I don't have to get my teeth scraped anymore. I mean, I still have to go to the dentist, but I'm not going to have to get my teeth scraped, So I kept doing it, and obviously I didn't look forward to it because when the hydro, like I said, your gums peel and it hurts. But what I noticed was over time it hurt less and my gums peeled less. And then what I noticed was that it didn't hurt at all and my gums didn't peel at all. And then after that, I noticed, like after 2 weeks, I started to have this impulse inside me that said, wow, I call it an acid wash. When I acid wash I have this impulse inside me that says, wow, I really need to acid wash my teeth. My teeth feel dirty, right? So I went from loathing it to loving it, basically. So now I do it all the time, and well, not all the time, but because it still, it still takes a few minutes. It takes a few extra minutes. So, and I worked up this whole regimen where I brush my teeth for 5 minutes. I set the timer, then I floss, and then I brush my teeth for 5 minutes with baking soda, activated charcoal, and hydrogen peroxide. And then I rinse my mouth. I gargle and rinse my mouth with hydrogen peroxide for 30 seconds. And then I brush my teeth again. So I got a whole regimen. It takes like 20 minutes, right? So I do that like once every 3 months now. Really, if I do it once every month, it would not hurt at all. But if I stretch it out to 3 months, 6 months. So what the theory is, my theory is that your enamel is like polished marble, or polished concrete. And it's pitted, microscopically pitted. So microscopic life forms, bacteria, get in the pits, right? And if they're not gotten out, if they're not removed, then they grow. And like a plant that will tear down a bridge with its roots over time, if something isn't done about it, the bacteria will tear down your teeth over time if something isn't done about it. Now you got to imagine that your enamel is pitted all over. So it's going to have bacteria all over, and a toothbrush won't do it. I mean, it gets off the big stuff, but not the little stuff, the microscopic stuff. Nothing will really do it, in my opinion. And I don't really know, but I'm just saying that's just my layman's opinion. Nothing will really do it except something like hydrogen peroxide. There may be other substances out there, but hydrogen peroxide is an amino acid that your body generates naturally, at very small levels. Hydrogen peroxide, I don't know all the science, but it has something to do with ozone, rain, and tree roots. Hydrogen peroxide occurs in nature everywhere. People think it's like people think it's like rinsing your mouth with rubbing alcohol. It's not. It's different than that. It is an emetic, which means if you swallow it, you'll throw up. But sometimes you need an emetic. Like if you ingest poison accidentally, you might want an emetic to cause your body to throw up whatever's in your stomach, If it's a caustic poison, then maybe you don't want that because then when it comes up, it'll burn your esophagus. But anyway, that's a whole medical thing, but which I don't know anything about. But I'm just saying it's an emetic. It's not an antiemetic. An antiemetic is something you take like a Pepto-Bismol that will prevent you from throwing up if you're having a problem when you're throwing up and you can't stop, right? So hydrogen peroxide is an emetic. However, a tiny amount is okay. Like I drink Tiny Mountain all the time, and in my mind, it just basically coats the inside of my esophagus, and it kills germs and stuff like that. Probably like aerosolized, tiny amounts of aerosolized hydrogen peroxide gets breathed into my lungs, when I'm brushing my teeth and when I swallow tiny amount, like that. So there's a whole thing about hydrogen peroxide. People have written books about it. There's a doctor down in West Palm Beach that injects hydrogen peroxide intravenously directly into the bloodstream. I don't know how he does it. I don't know anything about it, but he claims to have amazing results and whatever. He's an alternative doctor. He's not like whatever. So it's the hydrogen peroxide is like a whole thing. It's like a whole separate thing. The point is that when I started to realize that my teeth hurt less and my gums peeled less, and then after a while it started feeling good, refreshing basically. That's when I started to think, it's like, wait a minute. I started to equate weakness with the lack of health. Okay? And I started to equate strength with health. So now, like yesterday or day before yesterday, I blew out my calf on the treadmill because I'm trying to learn how to run a 7-minute mile. So 7-minute mile is like 8.5 miles an hour. So I set the treadmill at 9 miles an hour, and I'm trying to work up to 5 minutes at 9 miles per hour. So right now I can go two minutes. Okay, I can go 2 minutes at 9 miles an hour. And day before yesterday, I got up to 1 minute and 55 seconds. And my leg was hurting, but I'm like, whatever, I only got 5 more seconds or whatever. No, it was hurting the whole time actually. And then at 1 minute 55 seconds, it felt like noodles inside my calf were like going like this. That's just what it felt like. I know this is strange, but that is what it felt like. I'm like, oh man, so I better stop. So I stopped, and now my calf really hurts, and I can walk, but I have to hobble, So now, a friend of mine recently had a problem with their knee. I think it was called Baker's knee or something like that. Anyways, you get water on your knee and you can't bend your knee. Okay. And the doctor told them to wear this cast on your knee and don't move your knee. And I'm thinking to myself, I'm like, that doesn't sound right. I mean, just my own general view of things. That's like, that doesn't sound right. So, you want to keep moving because that moving is what generates circulation, and you need fluid. Whatever injury is in there, it needs nutrients and fluids, and especially blood, so that it can have the raw material that it needs to work to fix it, right? So I'm like that, but I'm not a doctor, so I try not to say too much. I usually say something, but I try not to say too much. And if I do say something or too much, they don't listen anyway because I'm not a doctor, which makes sense, right? So, but anyway, so long story short is, I don't know for sure, but I'm pretty sure it turned out to be that I was right, that they weren't supposed to not move their knee. To me, that's just crazy. It's like, no, keep moving. When you stop moving, that's when you die. And this is especially relevant for, I'm 55. It's especially relevant for old people. That's why old people die. That's why they get sick. It's like that old saying, you don't grow old and stop playing. You stop playing and grow old, right? There's a cause and effect there. And it's the reverse of what most people think, right? So with respect to my calf, now today was my day to run the stairs 3 times, and it's 15 flights. So 15 flights of stairs times 3. Well, obviously I can't run the stairs. I have to hobble when I walk. So I could have just, in my old way of thinking, and the standard traditional way of thinking, people would say, well, then just don't do the stairs because your leg is hurting. Well, I said, no, I'm going to do the stairs even with a hurt leg, And if I have to walk and hobble, I'll walk and hobble, So that's what I did, and I did walk and hobble. I couldn't run, but I hobbled my 45 flights of stairs. And it was painful and it was awkward. But you know what? After I'm done now, I feel better than when I started. So I think, and that's why I want to make this video, because I think this is confirmation that we're all being fed not just a lie. We're being fed a giant ocean liner cargo ship full of lies. Like basically everything they tell us is a lie. And everything they tell us is designed to make us sick, weak, stupid, and dependent. They want us to be wards. They want a herd of dumb livestock that can't think for themselves to manage. That's their dream. There's a guy I follow online who says they would rather be the single, all-powerful rulers of a barrio, of a 7 billion person barrio, than the, which is basically a slum, than the, the honest rulers, servant leaders, basically, the honest servant leaders that share power with everybody, over paradise. Okay, and that makes sense. At least it does to me. We all know people like that. Like they want complete and total control, no matter what it takes. They destroy the people they control. They don't care. They don't care. The only thing they care about is their control, their power. So I think that's what we're dealing with here, and I think I feel like God has really put on my heart the old people. The old people have conditioned to be pathetic, helpless wards. And it's everybody. It's not just the old people. I mean, the kids in college, the kids that come up through our institutionalized education, our institutions of education. I mean, and it's every institution. It's the media, it's government, it's commerce, Walmart, Amazon, blah, 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 blah. Everything is just like we all just sit around and have stuff brought to us. We're being conditioned to be incompetent, helpless, pathetic wards, basically, that are full of pride and a sense of entitlement. Because pride and entitlement, like the Bible says, pride goes before a fall, and entitlement is the path to incompetence. Because if you have everything given to you and done for you, you can't do anything, and you can't go get anything on your own. You're totally incompetent, right? But it's like a tricky, it's like a giant mind trick, really. So anyway, in the gem they say that pain is the feeling of weakness leaving the body. So that's sort of like a reflection or a different expression of what I'm trying to say here today. Is that, like I said, when I was rinsing my mouth hydrogen peroxide and my gums were peeling and my teeth were hurting, that was the feeling of the dead or almost dead or somewhat dead skin on my gums being removed so that it could be replaced with healthy flesh. And the pain on my teeth was the irritated nerves in my teeth being irritated, being provoked by the fact that the bacteria that was irritating them was being destroyed, right? So everything was inflamed, not at an observable level, but everything was inflamed, or what do they call that? There's a word for it. It starts with I. Everything is inflamed. It's not inflamed. It's I can't think of the word right now. Anyway, but it basically means irritated and inflamed, whatever that word is. Now the other thing is, I notice that when my teeth are in really good condition, like when I am doing the acid bath, and I've been doing it consistently enough, once a month is all it takes. Okay, but I don't do it I do it like once every 3 months, once every 6 months. And at this point in time, I've been doing it so long, so many years, that even once every 3 months, once every 6 months, it doesn't really hurt at all, but my gums do still peel a little bit. So there's some dead skin building up in there, that if you look at it, it looks fine, but in reality, it's not fine. So the hydrogen peroxide strips it away. But the other thing I want to say real quick is that when I'm being consistent and faithful to take care of my teeth the way I've learned to take care of it, then I don't have the cold and heat sensitivity anymore. So I wish I could think of that word, that when things are inflamed and irritated, it says all disease is inflammation. Oh, that's inflamed. Yeah. Okay. Inflammation. Yeah. So my theory is that cold and heat sensitivity are signs of inflammation. Even if it's not observable by sight, it's inflamed nonetheless, at a micro level. And that's what causes the pain. So that's my theory about that as well. So, all right, thanks for watching my video. Thursday, February the 4th, 2021. Pain and healing and pain. I was talking about my teeth and my calf. God bless you. I'll talk to you soon.